May the vital force be with you.
May the vital force be with you.
Hey everyone, I'm Dr. Larry Malerba, and welcome back to the ATH Materia Medica series. Today I'll be talking about Spongia tosta, which in some reference books is alternately referred to as Spongia officinalis. Spongia is a homeopathic remedy made from the sea creature known as the sponge, which is a multicellular animal that lives in salt water. Taxonomists classify it as a member of the phylum Porifera. This remedy is used primarily for acute conditions, especially for coughs, but it can also be helpful for certain chronic health problems. So let's take a look at the Materia Medica of Spongia. Okay, so I think it will be helpful to first identify some of the main features of the remedy Spongia. Those features include dryness, respiratory conditions that involve coughing, a sensation of suffocating, anxiety, and symptoms that are aggravated by sleep. Spongia fits dryness of the mucous membranes, especially the tongue, pharynx, larynx, and trachea. And it's a remedy for dry coughs where there's little to no mucus produced. This dryness is often accompanied by rawness or soreness of the throat and the air passages. Spongia is often given for coughs associated with colds, bronchitis, pneumonia, asthma, or even whooping cough. However, it's most commonly indicated for croupy coughs and cases of laryngitis. In all such cases, we see a dry cough that is accompanied by a feeling of being suffocated. The person can feel like he is choking or unable to breathe. This suffocating sensation or inability to get enough air can be caused by a variety of factors. There may be a constricting or contracting or sudden grasping sensation in the throat or in the larynx. Some describe it as a sensation of a lump or a plug or a leaf or a valve in the throat or in the larynx. These conditions of the airways are often accompanied by a feeling of being unable to breathe adequately. And it's not surprising that these experiences would trigger a feeling of anxiety. There can be anxious breathing or even panic attacks associated with this feeling of suffocation. And finally, this anxiety and sensation of suffocating is often aggravated during or around sleep. The person may feel like he can't breathe when falling asleep, or it may wake him from sleep, or can happen after sleep. Now, when we think about it, a sponge is a sea creature. It lives in water and naturally doesn't do well when removed from water. It needs moisture, and it definitely does not like to be dried out. The symptoms of spongia are often defined by their dryness, and as we shall see, those symptoms tend to be aggravated by dry conditions and are ameliorated by moisture. All right, since Spongia is mainly a cough remedy, let's first talk about the characteristics of a Spongia cough. Of course, it makes sense that it would be a dry cough. There can be dryness of the throat, dryness of the larynx, or dryness of the airways. And this dryness causes an irritation or itching or tickling sensation in the throat, larynx, or chest, which in turn triggers a cough. The cough is often triggered by an exposure to cold, dry winds. And the most important modality is an amelioration from drinking, especially from drinking warm drinks. Again, this makes sense knowing that a sea sponge needs moisture to live. The cough is also better from eating, especially warm foods. Additional cough modalities include worse from talking, worse from eating sweets, and worse from touching the throat, especially in the area of the larynx. Sometimes the cough can be aggravated by cold drinks. And lastly, the cough tends to flare up around sleep, especially when trying to fall asleep or between midnight and 2 a.m. As you may know, Spongia has a reputation for being one of the main remedies for croup. A croupy cough is usually dry, barking, and harsh sounding. Spongia fits coughs that have a barking sound, like a seal bark. It sounds something like this. Uh, 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 uh. It's also been described as sounding like a saw cutting through wood. The Spongia croupy cough is worse on inspiration and tends to be worse around midnight. Many homeopathic books speak of Spongia as being one of a trio of remedies used for croup. They recommend aconite first in the early stage of croup, followed by Spongia, and then hepar sulph for the later stage. Although this can sometimes be an effective approach, it's really a shortcut that avoids the hard work of proper case taking. It's always best to choose a remedy according to the unique symptoms of the individual case. Now, as with croup, it's quite common for Spongia-type coughs to emanate from the region of the larynx. We think of Spongia, for example, when symptoms of the common cold eventually settle into the larynx. And so Spongia is also a remedy for hoarseness, hoarse coughs, and laryngitis too. The hoarseness can be accompanied by dryness and or tickling of the larynx and the airways. The region of the larynx may be sensitive to touch, and the hoarseness is aggravated by talking and singing. In fact, Spongia can be a remedy for the hoarseness of singers and public speakers. There may also be pain in the laryngeal region that is aggravated by coughing, swallowing, talking, singing, or touch. The strong affinity of Spongia for the larynx is such that we consider this remedy when we see hoarseness as a concomitant of any illness. Now, Spongia is also a remedy for asthma. The asthma is aggravated by catching cold, and there can be a noisy whistling sound on inspiration that some describe as a sensation as if breathing through a sponge. The asthma is associated with a feeling of dryness and is often aggravated at night, especially around midnight or upon waking. Sometimes the breathing trouble is ameliorated by bending the head backwards. We also think of Spongia in cases of asthma that flare up during the menses, after the menses, or from suppressed menses. By the way, it's important to understand that allopathic diagnostic labels are often very misleading. Sometimes the true nature of a person's problem does not match the diagnosis that they've been given. I've had patients who tell me that their chronic hoarseness has been diagnosed as allergies or acid reflux, and I've seen others who say that their feeling of choking in bed at night has been labeled asthma. Still others are told that their breathing difficulties are symptoms of anxiety. In many cases, those diagnoses are debatable. That's what makes homeopathy so unique. Homeopaths understand that diagnostic labels are oftentimes meaningless. Sometimes a symptom picture of a patient doesn't fit neatly into any known conventional medical category. But that's okay, because homeopaths know that it's not the label that counts. And homeopaths are the only ones who take the time to truly understand the symptom picture of the patient. And that's what really counts. Okay, now, there isn't a lot of information regarding the mental picture of Spongia. One main feature, however, is the psychological effect caused by Spongia's difficulty in breathing. There's anxiety about the inability to breathe freely. There tends to be a fear of death from suffocation, especially at night, when spongia symptoms are more likely to be aggravated. There can be anxious breathing and even panic attacks. Spongia may startle from sleep and may need to sit up in bed to gain his breath and his composure. There may be a fear of suffocation from asthma or in association with heart conditions. Of course, the experience of feeling suffocated, whether from coughing or choking on waking or throat constricting, is very real, and the anxious feeling that accompanies it is real too. Sometimes this can extend to an anxiety about health in general. In addition, there may be irritability, weepiness, and even despair. Now, in terms of generals and modalities, spongia has an affinity for the respiratory tract, especially the larynx, and as we shall see, the cardiovascular system and the endocrine organs, especially the thyroid and reproductive organs. Spongia is generally chilly but can have sudden attacks of or flushes of heat, especially when anxious. And its respiratory problems are often triggered by exposure to cold, dry, windy weather. And they may be ameliorated by damp, wet weather. Again, think of the fact that sponges are sea creatures. Spongia tends to be both hungry and thirsty and has a preference for warm food and warm drinks, both of which, as we've seen, ameliorate the cough and respiratory symptoms. Again, think of a sponge's need for moisture. And even though spongia can have a desire for sweets, sweets tend to aggravate the cough and sore throat. As noted previously, spongia tends to sleep into an aggravation. Its coughs, asthma, choking, and suffocating sensations tend to be worse around sleep, especially on falling asleep, on waking from sleep, and between midnight and 2 a.m. Additional modalities include an intolerance of tight clothing and an aggravation from pressure or touch, especially when touching the throat or region of the larynx. Coughs and respiratory symptoms are worse upon inspiration and worse from talking and singing. There also tends to be an aggravation from motion and exertion. One source that I came across said that there can be a desire to bathe, which makes sense knowing that sponges live in water. All right, now let's talk about some additional health problems covered by spongia. Okay, now, spongia is also known to fit a variety of heart conditions, including coughs associated with heart disease. There may be a sensation of swelling of the heart, as if it will burst, like a sponge soaking up fluid. Along with this, there may be a feeling of chest oppression, fullness, or constriction. Sometimes there's exhaustion with congestion of blood to the chest and face that is brought on by the slightest exertion. Additional cardiac conditions include heart valve disorders, aneurysms, and arrhythmias. Spongia fits palpitations that are accompanied by difficulty in breathing. Not surprisingly, the palpitations tend to be worse while lying, worse at night, and can wake the person with a feeling of suffocation. It's also a remedy for palpitations that are worse before or during the menses. And it fits palpitations associated with hyperthyroidism, which brings us to the next category of spongia pathology, which involves certain endocrine organs. All right, now, spongia has a strong affinity for the thyroid gland. In fact, the sea sponge has a calcium silicate skeleton that contains iodine-related compounds, and iodine is the main element required to synthesize human thyroid hormones. And in addition to Spongia, the iodine-related remedies like iodum, calcarea iodata, and kali iodatum are remedies indicated for a variety of thyroid conditions. We think of Spongia in cases of goiter, which is a swelling or enlargement of the thyroid gland, and it fits coughs and suffocative spells associated with goiters. It also fits hyperthyroidism and symptoms typical of that condition, which include palpitations and exophthalmia. Exophthalmia is a protrusion or bulging of the eyeballs that is often associated with thyroid pathology, especially hyperthyroidism. I did a quick repertory search, which brought up the following thyroid-related rubrics that list Spongia. Just a few of those rubrics include sensation that the thyroid gland is alive, cancer of the thyroid gland, constriction of the thyroid, pain in the thyroid gland, swelling of the thyroid gland, choking or constricting from goiter, difficult breathing at night with goiter, cough with goiter, asthma with goiter, palpitations with goiter, and exophthalmic protrusion of the eyes. The final category of Spongia-related physical problems that I'll quickly mention involves the reproductive organs. We think of Spongia when we see pain, swelling, inflammation, or enlargement of the ovaries, but especially of the testes. It can be a remedy for epididymitis, orchitis, and even metastasis of mumps to the testicles. All right, now let's finish up with remedy relationships. Okay, so as previously mentioned, aconite, spongia, and hepar form a trio of remedies that are sometimes given in that order for croupy coughs that are brought on by exposure to cold, dry, windy weather. Therefore, remedies that we want to compare to spongia include aconite and hepar sulf, both of which are very anxious, have ailments triggered by cold, dry winds, and can have a fear of suffocation and suffocative coughs. Aconite is best suited for the earliest stages of an illness, and hepar fits later stages when mucus production has developed. Lachesis has a lot of choking and suffocative symptoms that are similarly aggravated during and around sleep. It too is very sensitive to pressure and touch to the regions of the throat and larynx. Phosphorus is similarly anxious and fits a wide range of respiratory conditions, including hoarseness. The difference is that phosphorus prefers cold drinks. Iodum fits a wide variety of larynx and thyroid conditions, including goiter, hyperthyroidism, exophthalmia, palpitations, hoarseness, and croup. Rumex fits hoarseness and dry, irritating, tickling coughs that settle into the larynx. Symptoms are worse on inspiration and worse from touch or pressure on the larynx. Coccus cacti also has choking, irritation, and tickling of the larynx, which is worse before midnight, but the difference is that Coccus cacti has a great deal of mucus and is better from cold drinks. Lycopus virginicus can have a similar combination of heart and thyroid problems with goiter, hyperthyroidism, palpitations, and trouble breathing. And lastly, nausea, like most snake remedies, has a lot of throat and larynx symptoms in addition to palpitations, cardiac cough, cardiac asthma, heart valve problems, suffocation, and a tendency for symptoms to be worse around sleep. All right, so that's everything you always wanted to know about Spongia, but were afraid to ask. Thanks for watching. If you subscribe to the channel, you'll be notified when new episodes come out. And until next time, may the vital force be with you.